People in Kentucky experience some of the highest rates of cancer, cardiovascular disease, substance use, diabetes, and obesity in the nation. And the burden of these health inequities falls heavily on rural, minority, and socioeconomically disadvantaged populations. Through research and training, the Center for Health Equity Transformation seeks to improve the health of the most vulnerable residents of Kentucky and beyond.
So the Center for Health Equity Transformation came online as we were developing the Healthy Kentucky Research Building and the concepts, how we would orchestrate research to understand all the health problems that Kentuckians face on a regular basis. In the top 10, not where we want to be.
The mission of the Center for Health Equity Transformation is to catalyze innovative and impactful research that can have a positive effect on people's health. We have a lot of prevention and approaches to chronic disease control that are really evidence-based. So making sure that those populations are able to enjoy the benefits of prevention and early detection and optimal treatment is what we aspire to do.
Different populations need things differently. And so equity is critically important because it recognizes that we are attuning to the needs of diverse populations based upon their needs, based upon some of the social, cultural, psychological kinds of issues that limit their ability to maximize their quality of life and their health care.
It's our responsibility to do everything possible and team up to address these health inequities. And we can come up with the greatest new therapy we could imagine. But yet, if it's not accessible or usable or understandable to a particular community, it's not going to be very effective. And I think we need to understand that at a local level. And the center really takes high priority, really understanding the community and getting there at a local level.
With 7 primary faculty, 15 core faculty, and more than 140 faculty affiliates across UK, the center engages the campus community through a workshop series, pilot grant program, training in biostat design course, and grant consultation.
When you really think about how tobacco is marketed in communities, it's quite inequitable. The ways in which they've targeted racial ethnic minority populations, low income, socioeconomically disadvantaged populations is particularly troubling because of the way that tobacco use differentially impacts those populations. Particularly menthol cigarettes have been disproportionately marketed to African Americans to the point that almost 90% of African American smokers smoke a menthol cigarette. And menthol in particular has been associated with more difficulty quitting and more progression to regular use. When you think about marketing a flavored product that may be more appealing to a community that may be already more disadvantaged, you really start to see how unfair that is and how we really should be putting a bright spotlight on that and figuring out ways to use policy or interventions to reduce that impact. Everybody in the center has a real commitment to health equity. It's not only in the research that we're doing, but also the training components.
The Center for Health Equity Transformation is creating a pipeline to train the next generation of researchers. The SPARK program for undergraduates provides mentorship and trains students to design and conduct applied research projects.
So my project is about sex trafficking in Kentucky, and I'm looking at what the recovery process typically involves for sex trafficking victims and what sort of services are available to them in Kentucky and who else they collaborate with, certain organizations, who else they work with in order to make the recovery process happen successfully. I've been interviewing people that work in programs that provide services for sex trafficking victims and have been asking them questions about the recovery and re-entry process for victims. To be able to come up with your own survey questions and your own research topic and go out into your community, ask questions and get answers, I think it's just a great opportunity for any student. I think as a student, especially like a minority student, I think it's great that there's a center dedicated to research for minority populations, whether it's race or socioeconomic status or whatever. I just think it's great that there's a center that's dedicated to finding answers.
I would say that the Spark program has been one of the most rewarding things I've done in higher education. I've been able to work with undergraduates very closely as the research program coordinator. I was able to take them from the very beginning of how to develop a research question all the way through the process of getting IRB approval, which they all were successfully able to do, and then going out into their communities collecting data. And I think it's been most rewarding because as a researcher, as someone who loves research, I'm able to help someone else develop those skills.
The Dream Scholars Program provides networking and mentorship for predoctoral, doctoral, and postdoctoral scholars.
My experience as a Dream Scholar has been great so far. For the past year, I've been exposed to different levels of scholars, junior scholars like myself, as well as senior scholars. I think it's really important for us to all work together and do this great work that we're so passionate about. And I want to know how vicarious racism impacts the psychological well-being of Black Americans. So I want to know who's reporting vicarious racism the most. Are there age differences, gender differences, socioeconomic status differences? And then also I'm trying to determine what psychosocial resources moderate the relationship between vicarious racism and health outcomes. It's important that UK is, as the flagship institution, has a Center for Health Equity Transformation so that we can, as a center, begin addressing some of these health inequities that are so prevalent, particularly among Kentuckians.
We know that when we have diversity, it impacts the ways in which we enter into conversations, we explore different phenomena, we strive to bring about different cures to diseases. And so we are excited that this initiative will help to diversify some of our researchers, create a pipeline that helps to explore some of the health-related issues, and they will work arm in arm, shoulder to shoulder, to help eradicate some of the health inequities that exist throughout the state of Kentucky.